Hello guys, this is your girl Mary. You are welcome to our channel once again. The channel name is Charles and Mary. Guys, please don't forget to subscribe to our channel. Click on the notification button, leave comment, and don't forget to give us a thumbs up. Thank you. So today we are coming to talk about health, and the topic I chose for today has to do with vaginal yeast infection. We are coming to talk about what is it, as in what is vaginal yeast infection and how it is treated. So, vaginal yeast infection that we know is mostly caused by Candida albicans. And Candida albicans is the name of the yeast that causes the vaginal yeast infection and often considered as fungus. So, Candida albicans lives naturally in the vagina, okay? Then, together with bacteria, Candida maintain the natural balance in the vagina. Under certain circumstances, the balance gets disrupted, which means we have some people, they use foreign bodies in their vagina. So by applying these foreign bodies inside your vagina, the fungus can start to grow excessively and an infection occurs. And these are few examples of the things that we do and or that happen to us that causes this excessive infection in our vagina. And example is repeatedly washing and rinsing your vagina with soap. Some of us goes to the washroom, or when we are going to bathe, we use soap that we are supposed to use in bathing, or the soap that we've been using in bathing, we use it to wash our vagina in and around our vagina. So by doing this, you are killing all the bacteria that is supposed to protect you. You are killing it and rather infecting yourself. And some too is the antiseptic liquid that we use in cleaning germs on our surfaces. Some people pour it into water when they are going to bathe. Then they end up using that water to wash their vagina. When you are doing that, you end up getting candidiasis. And another thing too that happens to we women that causes this vaginal yeast infection too is hormonal fluctuation or hormonal imbalance. When your hormonal doesn't balance well, you end up having this vaginal yeast infection or this fungus. And another thing too is the use of antibiotics. We have some people out there, they like taking antibiotics. Every little thing at all that happens to them, all they know is, let me take this antibiotic and it is done. Please, rather you are harming yourself. Don't just walk into a pharmacy and say you are buying an antibiotic. So don't just take antibiotic because you feel like taking antibiotic. And another thing too that causes this fungus or vaginal yeast infection is when you are a diabetic. When you are diabetic or your immune system is very decreased, for you getting vaginal candidiasis is just a click. So you always need to do things that will prevent you from getting the vaginal yeast infection. Always protect yourself against all of those things. You are at risk, higher risk of getting vaginal candidiasis. Slightest mood, you are getting a vaginal candidiasis. So you need to take good care of yourself very well so that you won't be getting this infection always or every day. So now let's talk about the symptoms of the vaginal candidiasis. So some of the symptoms of vaginal candidiasis is itchy in and around the vagina. So when this itchy start, especially in and around your vagina, then you have to know that you're having symptoms of vaginal candidiasis. And another thing too is when you're having pain, burning sensation in and around your vagina, that is also another symptoms of vaginal candidiasis, because you scratching the place, it has caused some harm around that place, because that place is very soft and you're scratching it. Sometimes your nails that even you're using to scratch it even can cause sore around that place. That is how can you be having these burns around there, and sometimes pain during urination and during intercourse, because there is sore in and around that place. And another way to know that you have symptoms of vaginal candidiasis is you'll be having this redness and this white flaky coming out from your vagina. When immediately you are seeing those things, then which means you are having symptoms of vaginal candidiasis. Some vaginal candidiasis does not have any symptoms at all. That one, you don't get the itchiness, nothing like burning sensation. So with that one, it can vanish by itself, or within some few days it will go by itself. In many cases, for you to treat your vaginal candidiasis, your doctor can make diagnosis based on your complaint and external features. So which means when you go and see your doctor and you complain, doctor, I've been having itchy, burning sensation during sex, burning sensation during urination, your doctor will not just go ahead to just prescribe medication for you, but your doctor will have to do further tests on you by taking some of the discharge that comes out of your vagina. They will take it to the lab and they will go and check under the microscope. It can be identified over there. Then with that one, the doctor is certain that you are really having vaginal candidiasis and you need treatment. So now from symptoms we are moving to treatment. So vaginal yeast infection can be treated well and easily with medications. That's one thing you should know. It's not something that will be there permanent, or that is always there permanent. If you have vaginal candidiasis and you go to your doctor and your doctor has did all of these things based on your complaint, and they've taken a bit of your vaginal discharge to the lab and they've identified it under a microscope, it can be treated well and easily with medications. Vaginal candidiasis can be treated with medicines that kills the fungus. So your doctor doesn't just write any medication for you, but he writes medications that he thinks, or medication that is meant or manufactured to treat the fungi that causes the vaginal yeast infection. Locally treated, such as vaginal pill or cream for internal use. The pill is normally taken orally through your mouth. Then the cream you will have to insert into your vagina and around your vagina. So that's how the treatment is. Vaginal yeast infection usually disappear after 2 or 3 days. So if you start taking the pill or you are using the cream for your internal use, within 2 to 3 days, you have to start seeing signs that, okay, I'm getting well. If you are not, you have to go back to the doctor so that the doctor will check. Could it be that maybe what he has prescribed for you is not good for you, so he should change it to a different medication? So you need to do this. It is advised to avoid sexual intercourse until your complaint or your symptoms, the symptoms that you're having, all has vanished. When you have vagina candidiasis, you don't have to be having sexual intercourse. You are supposed to abstain from it until the symptoms you are having or the complaint that you went to the doctor to complain all have vanished before you can have sexual intercourse. And even in some cases, you're supposed to take your partner to your prescriber or to your doctor for your doctor to ask him some few questions, maybe about the symptoms. If he's also having the same symptoms, then your doctor will treat him, because you as the lady or the woman, you can treat yourself. And after treating yourself, you can go back to your partner, you have the sexual intercourse, then you get yourself infected again, because when you were having the vagina candidiasis, you infected your partner and your partner didn't treat himself. So after you are done treating yourself and going back to your partner, you went and carried the sickness, the bacteria infection again. So in most of the cases, you're supposed to take your partner to the doctor, so that when your doctor asking few questions and it's just the same as the symptoms, then he will get himself treated. Then both of you can continue with your intercourse in one harmony without infecting each other. Today, I hope we've learned a lot about what vaginal yeast infection is, which is the same as vagina candidiasis. We learned about the causes, the symptoms, and the treatment, and I hope we'll put it into practice. Please leave a comment on what you think about what we discussed today or what we learned today. Let me know your views on it, and you can ask any question at all you want on it, and I'll be here to answer all your questions. Thank you. Remember to subscribe to our channel. The name is Charles and Mary. Click on the notification button and don't forget to give us a thumbs up. We love you, and bye for now.